Hello everyone, I'm Jr-wei Wu from Taiwan, and I'm also the head of the communication committee of the IHS. And today we invite Wanakorn Rattanawong from the King's Mongkut Institution of Technology, Ladkrabang, to introduce his great research in the headache care in Asia. So, Wanakorn, probably you can provide a brief introduction of your research findings.
So thank you very much, Jr-wei Wu. Hello everyone. I'm Wanakorn from Thailand, and it's a great pleasure to be here with Jr-wei Wu in this international headache conference. So the research that we were doing, and also that Jr-wei Wu is also involved in this research, is actually a research about asking doctors' perspective around Southeast Asia. So we have been including a lot of doctors from every backgrounds in the countries in Southeast Asia, and we're asking about the perspective of the diagnosis of migraine. What are their challenges? About the acute treatment, what are their challenges? Preventive treatments, and also we have been looking into the stigma that has been going around in Southeast Asia as well. These are the things that we have been conducting in this past year.
Okay, so the first question is that what is the Asia stand today on the headache diagnosis and the specialist access?
So there's a lot of problems in Asia, as we might know that Asia is a very large continent. We have East Asia, we have Southeast Asia, we also have the Indian subcontinent and also the Middle East. These are all Asian. So we can see that with this vast cultural and things leads into a lot of problems with language barriers and also with how do we actually treat the patient and also how do we actually diagnose patient because we're actually talking in a different language there. And the other things that we found is that it's also about the accessibility. We know that the majority of people around the world is actually saturated in Asia. So therefore, the amounts of doctors or the amount of patients that actually could see a specialist is very low. And for example, in Thailand, we one neurologist would treat around like 80,000 patients, while in India, that I have been, I also been to India talking with Indian doctors, is that one doctor would treat around like 300,000 patients. So we can see that these amounts are it's very hard for a doctor to actually treat and these patients could actually access these doctors.
So, do you think about how many headache patients who can receive the correct headache diagnosis by the specialist in
Mhm.
Asia?
So in our diagnosis, what we found is that it took around more than 50% of the patients who actually get a diagnosis, I mean, like less than 50% to get a correct diagnosis within 1 year. And a lot of patients actually get more than a correct diagnosis more than like 5 years. So this is the problem that we still face in Asia because we can see that the number of days, the number of years that we wait the more the patients would turn into a chronic migraine, it's even harder to treat.
Okay, so uh, what is your what is the current most what is the treatment availability of the new migraine therapies in Asia? What do you think about it?
So we know that the after the introductions of anti-CGRPs, it has revolutionized most of our treatment in Asia as well. But the problem with Asia is that these medications are not reimbursed in every single country. Like we'll just talk about, like for example, Thailand. Thailand these medications has never been reimbursed. So these are the things that we still face a problem, despite we know that the patient is in need of these medications, is that the patients could not receive that. And because of our incomes of our patients are not very high, especially the majority of the countries in Asia are middle to even low incomes, and therefore these medications are very expensive and to access them are very, very hard. So these are the challenges that I think still in Asia, and we really need to tackle these problems in terms of we can do economic analysis, research that we're trying to conduct in Southeast Asia, and also that if these comes, we can tell our government, we can tell our those of who the authorities are, and then to actually make these medications available for everyone in Asia.
Yeah, that's a great challenge in Asia. In Taiwan, as the General Secretary of the Taiwan Health Society, we try to do some advocacy to our government, and we organize several headache courses for the neurologists and even the GPs to improve the headache diagnosis and the percentage of patients who receive the correct treatment.
Yeah.
So that is our strategy. So the next question is that, according to your analysis, how many patients in Asia who receive the preventive treatment, and what is the most challenge part to implement the preventive treatments for migraine patients in Asia?
So you mean the all preventives, right?
Yeah, all
Okay.
preventive, the
So
old one and the new
mm,
one.
so definitely is that this has also been a challenge as well, because when we talk about preventives is that there's only around like 20 to 30%. And I think that the Taiwan has also done this study
Yeah.
as well, that only 20 to 30% of the patient actually receives preventive medications when they actually are in need of these medications. So this has been a problem. And one of our studies that we done, the Sealand study, is that we have also accessed this, and a lot of doctors actually say that the problem with not prescribing preventive in the doctor's perspective is that they do not have that much of information or that much of a knowledge to actually prescribe these medications. And I think we really need to go down into, I mean, like even into med schools, treating more, giving more information, giving more learning lessons at the start of like medical school, so that people are very confident to actually prescribe preventive medication.
Thanks for your great answer. And I think the education is a very important issue for the headache care. In our own experience, after we revise our new guidelines, we organize several meetings and congress for the not only the headache specialist, but also the neurologists and even GPs to introduce our new guideline of the migraine preventive treatment, and to provide them very clear information when and how to begin with the migraine preventive treatment. I think this is very important. And also the education is very crucial for improve the migraine care. In my experience, I always let the medical students to come to my clinic to learn how to access, how to make correct diagnosis, and how to treat the migraine patient. That's important. So next part of the question is that what do you think about the difference between the headache patients in Asia and in Western populations?
Okay, so definitely there's totally a different, and I have to praise Dr. Sujin Wang for actually giving a lecture. And if anyone could actually have come to the IHC, there's have been a very great lecture by him talking about the difference in East and West. And that is actually true. There's a lot of things that happens in Asia that doesn't happen in the West. Like, for example, Asian populations have a lot of problems with nausea, while in the
Yeah.
West, they do tend to have problems with photophobias and
Yeah, true.
photophobias, and these are the things. So what I think is very important in terms of treating patients in anywhere in the continent is that we have to go and ask the patient what are their bothersome symptoms. What do they bother the most? Sometimes what we would like to hear is something that's very different from the patient, that what the patient really wants to hear from us as well. So I think that this is something that we could do as a society, is that we go into the patient, ask the difference, what the patient is actually suffering, listen to them, and treat them according to what they're actually suffer. So I think this is something that we can do, and this is why it is so different from what we treat from the West could not sometimes be treated in the East. And also is that I think Eastern culture, we have a culture of very traditional
Yeah.
things, and that is why we have to respect the culture of the East as well. And then so sometimes a lot of things like traditional treatment could also come into play as well, like the Chinese traditional things that you have, or the Thai traditional medleys like that. So those are the things that I think we could find a balance between the treatment of the East and the West, and then to make uh, people actually get better from migraine.
So that's a great point, because there are several difference in the symptomatologies and presentations of the headache patients between the East and West. So I think more research in conduct in East Asia population, I think it is crucial for the headache medicine. For example, for cluster headache, compared to the Western populations, the East Asia populations had a less common percentage for the restlessness and agitations during their cluster headache attack. The percentage is 50. But compared to the Western literature, it's about 80 or 90. And another difference may not only for the symptoms, but also they have some difference in the neuroimaging. I do the low pressure headache SIH, and in the publications or papers from the Western populations, they found a huge percentage of patients had a diverticulum or the CSF venous fistula. But in our population, we collect a huge number of SIH patients, which several hundreds, but we found that there are less than 3% of patients who had diverticulum, or we have very rare low percentage for the CSF venous diverticular fistula. So that's a difference.
Yes.
Okay, so what do you think about the future of the migraine care or headache care in Asia?
I think this for the future of migraine care in Asia, definitely first is that we want people to actually we need more advocacy for the patients to get more awareness of migraines. And we have to also tell our doctors that migraine is a real disease that could be treated. These are the things that I think would be very beneficial for the future. Next is that for the reimbursement, everyone could actually get access to the treatment. And eventually, I wish in the future that more of the treatment would go into what we call precision medicine. Everyone has their own way of treatment and how to actually get them get better. That's what we hope to do in the future for our continent.
Thank you for providing very detailed and comprehensive review of the headache care in Asia. The theme of this year's IHC is migraine headache care for all. So I hope in the future we can conduct more collaborative research in Asia to improve the headache care. And thank you for listening to our video.
Yeah, thank you
Thank you.
very much, and thank you for having me.